Good evening. Welcome to the Humber River Health Community Town Hall, and thank you very much for joining us. My name is John Tory, and I'm here as the moderator, together with the chair of the board, Michael Iacovelli, Barbara Collins, who's sitting right next to me, who's the president and CEO of Humber River Health, and the hospital's chief of staff, Dr. Zaki, Ahmed, who is attending a conference right now. In fact, it's a national conference, Humber on the national stage, the Canadian Society of Physician Leaders, but he's with us through the miracles of modern technology. And we're glad that everybody online could join us. More people are joining every minute. And we're looking forward to speaking with you about healthcare, about the issues, about Humber River Health's programs, initiatives, and services. And part of the idea, a big part of the idea about this is that you should participate. And so a bit of housekeeping at the beginning. If you're on the phone and you have a question and want to voice your question on the phone, please dial *3, *3 to get into the queue. Or if you're joining us online at www.hrh.ca/live, we welcome you to drop your questions into the chat at any time. We already have some questions, which is great from people who are taking part. We're going to do our best to answer as many questions as we can. We'll also be hosting live polls through the course of the call and the webinar, and we'll instruct you on how to respond before the polling questions. Fairly straightforward. Just pick a number depending on how you want to answer. But let's jump right in with the substance of the meeting tonight. We are live in Humber River's Health's Command Center. This was the first all-digital hospital in North America when it opened, and it began all the work on this in 2005 with the planning for the hospital's new location, where it's been for about 10 years now. It opened in October of 2015 and was the first North American fully digital hospital. And a lot of the command center, the brain of the hospital, is right here behind us. The hospital is located at 2035 Wilson Avenue, near Keele on the 401. And the first generation of this command center was launched in 2017. And you'd be amazed at everything that's picked up here, every sort of movement of every person. It's unbelievable, the amount of information. I should say, by the way, and it's not in my script here, that this hospital does a lot of outstanding things every day. But I had a chance as mayor when I was handling the pandemic with many others to see just how special a place this is. And this was a place that innovated. It was a place that really got into the communities to help people that it served. And it really was something that did this hospital proud. And I hope that you're aware of that. I'm sure you are. Since the launch of the command center, and it just shows you these things aren't all about numbers and pictures behind me on the wall on computer screens. Humber's safer care numbers are more than 60% better than the average at all Ontario and Canadian hospitals. And they've maintained this kind of an edge in terms of safety for a number of years now. In addition, there's been a 10% year-over-year reduction in sepsis cases, a 44% decrease in code blues, and a medication error rate of only 0.009%. That's a lot less than 1%. It's a very good track record. So today what we've done is select some healthcare topics that may be relevant to you, but we don't want to interfere with your choice of topics and questions and comments you want to make. So you press *3 to get into the lineup to ask a question, or write it in the chat. And again, I'll go back to just giving you that address. Sometimes these things are a bit of a mouthful. It is www.hrh.ca/live. You can go there and put in a question in writing, and we will go through those as we work through the list that we have. So we're going to start off addressing a very hot topic in healthcare today, and I think probably for a long time. Many people have known someone or have themselves been someone who's gone into an emergency department or into any hospital in general and have experienced long waiting times for appointments and for tests and for procedures and feel that the time involved is too long. And so one of the questions we wanted to put to CEO Barb Collins, who's here, as I said, is what is Humber River doing about wait times? So I'll remind you before turning it over to Barb, we are here with Barbara Collins, the CEO of Humber River Health, with the chair of the board, Michael Iacovelli. The board is the oversight body that looks after the hospital, and CEO reports to the board. Everybody has to report to somebody. Right. And last but certainly not least, the chief of staff, Dr. Zaki, Ahmed, and he will deal with one of the three topics as well as a very senior medical practitioner and a highly respected physician. And we will be taking the calls from the viewers. So again, dial *3 or write into the chat to get in. Barb, over to you on emergency wait time. One of your favorite subjects.
One of my favorite subjects. Thank you very much, Bob. So first of all, in emergency departments, I should say across Ontario, there are triage systems. And patients, when they come in, depending on how they present, are graded from 1 through 5, 1 being the sickest and the most ill patients. And so, depending on what you've come to an emergency department for, I can tell you that the sickest patients, the twos, the ones, those that are in a very sick situation, whether they come by ambulance or they walk in, they drive themselves here, are always seen almost immediately or within minutes. And that is the good thing about emergency departments in Ontario. There are other patients who come in who have conditions that need to be seen and emerge, but they are not in a life-threatening condition. And those are the patients who tend to wait a little bit longer. Hospitals strive to have the wait time be about 4 hours from a physician initial assessment. Now, I should say it's within the first 15 minutes you arrive and emerge that a nurse will see you and do what we call a triage assessment. And at that time, determine, how quickly you need to be seen. For some patients, it's very obvious. For others, it is not. So at the time when the triage nurse sees you, your care has already started. Some of you will recall you may have had an ECG, you may have had blood work, you'll certainly have your vital signs taken, your blood pressure, your heart rate. So the work already starts. Then we need to have a physician see you, which depending on what kind of life-saving activities are going on in the emerge may take longer than you want. On average at Humber, we strive for about 3 hours from physician initial assessment. But that also might be because we're waiting for the blood work, we're waiting for some of your results to come back. So it's not always just seeing the physician that starts your care. Your care starts right away. At the Humber River Emergency Department, we are actually the busiest emergency department in Ontario. We see about 133,000 patients a year. Many days now it's 400 patients or more. The other thing is that we receive within that about 80 to 90 ambulances a day. You can be sure most of those ambulance patients come by ambulance because they require immediate care. We do, through the command center and through many other technologies we have the ability to see the moment a patient arrives in the hospital. We are able to look at what time they arrived, how quickly they're seen, what they're waiting for. Through our technology in the command center and our flow managers and the great work our staff and physicians do, we can juggle and adjust patients to get them seen a little bit quicker or to know what the delays are. And we constantly work on process redesign to be sure that those problems are being looked after. Hospital emergency departments are about inflow, but they're also about how quickly can you get the patient out of emerge. And we're very happy to say with the command center work and the good work of our staff and physicians, our patients don't remain, when they're going to a hospital bed, on average, they wait about 8 or 10 hours from the time of admission to get that bed. Humber does not experience hallway healthcare, again, courtesy of our work in the command center. And so one of the things that we find is we are able to move people more quickly out of the emerge up to a bed. They don't sit in the hallway, they go directly to a patient room. We just don't have hallway healthcare here. And the advantage of that is we can free up space in emerge for more patients to be seen. So when you come to emerge, feel free to ask questions, ask why you're waiting, ask the staff questions. We'll try to keep you informed, but often it's because a sicker patient, and be happy it's not you, has come to emerge and requires immediate care.
All right, that is a complete answer, and one, by the way, behind me, Barb made reference to this. There are eyes on the emergency department all the time. People watch right in this room, so lest you think nobody's watching and nobody's trying to make sure they solve problems that they come up, they are, and that's one of the benefits of having a place like this. And what we're going to do is we want you again to call if at *3. We have a couple of callers that are waiting. We'll get to that fairly soon. We have some written questions. Maybe just before we move off emergencies, Barb, I will ask you one, for example, where they say, what is the projected wait time versus what it is now? You made reference to the triaging into various time periods. Is there one where you can say, this is what it is today and this is what we're striving for? Or are we on target?
We are very close to target. We had a very, very busy fall. And when we have those days where there's 450 patients, our wait time will be a little bit longer. So we track how many patients are waiting 15 minutes, how many patients are waiting 2 hours, and how many patients are waiting 4 hours or more. Our 4 hours or more number comes out to us constantly. We can see it at all times. I see it twice a day. And wherever we see it more than somewhere between 2 to 4 hours, we have the ability to call an additional physician in and they come and help us clear the backlog. We all hospitals have been asked to try and aim for 3.5 hours wait time in an emergency department. We still see many of our patients within 2 hours or less. That's what we're personally striving for. That's what our board of directors has asked us to be responsible for. But there are days where that's, to be quite honest, just not going to be possible. depending on how many very, very difficult, very sick patients you have.
Kyla, thank you very much for the question. Do you want to comment?
Yeah, I just was going to say the board's very concerned about the wait times and very concerned about trying to do as much as possible to be innovative within the space. So one of the things that a lot of people tend to focus in on is what are we doing with AI? What are the things that we're doing with this type of technology to help the hospital and help patients? And one of the main projects that we're working on is Scale AI, that's helping with the wait lists, the wait times, identifying and letting people know what they are through AI integration.
Right. And Michael, thank you for bringing that up. It's a program that we'll be launching when you come into the Emerge now. We're just trying it in the emergency department by collecting the info. But the intent is that if you're unwell and you need an emergency department visit, but you are not ill enough that you must come right away, we actually will work with you from an app on your phone to advise you the best time that day to come in. And it may vary a little bit, it will change, but at the end of the day, you'll come in and you'll be almost booked for an emergency department visit. We hope to launch that within the next few months, and we think that that will also help us streamline the flow a little bit. We can use AI to determine when our busiest moments are each day, adjust our staffing and our activity to match that.
That's going to be a huge step forward, using your smartphone to stay on top of that and staying in touch with the hospital instead of sitting here waiting in the chair necessarily. Let's try out the polling device that we have, again, just using your phones or whatever device you're watching this on. And we're going to start with a fairly easy one. And don't worry, it's all anonymous. Nobody's going to disclose how you answered this one because it's about your age. And some people are sensitive to that. So we'd like you to participate and press the corresponding number to the answer you want to give. I'll go through those answers very slowly, but press 1 if you are between 18 and 30 years of age. Press 2 if you're between the ages of 31 and 49. And press 3 between the ages of 50 and 64, and 4 for ages 65 and older. And it just gives us a bit of a snapshot, tests out the technology and gives us a bit of a snapshot of who's taking part in the webinar. And I'll have these results come up here on the screen in front of me, be able to pass those along in a moment or two. So again, 1 if you're 18 to 30, 2 if you're 31 to 49, 3 if you're 50 to 64, 4 if you're 65 and older. And please enter the corresponding number to your response now, and see if it's come back quickly here. I think it has. Those are, just to check, are those the actual results that I'm looking at? Okay, well, just as a matter of interest to you and proves the technology works, we have 7% who are 18 to 30, 20% who are between 31 and 49, 30% between 50 and 64, and 44% who are 65 and older. Just showing yet again that it is the seniors who pay very close attention to what's going on in the healthcare system. And I'm thrilled, we all are, that you've all joined us. And again, it's John Tory just as moderator, and the chair of the board, Michael Iacovelli, Barbara Collins, the president and CEO of Humber River Health, and the chief of staff at the hospital, Dr. Zaki, Ahmed, who's at a conference out of town. That's why you see him not sitting here with us. And again, if you have a question, please dial *3 to get in the queue, and we'll get to some of those phone calls that are here in a minute, and a couple of more questions. Well, actually, it's time we can take some of the questions now. I gave you one, Barb, on the emergency room. Let me just ask, just on that same topic, because that's what we began discussing. Can we ask the provincial government, asks Giuseppina Cascato, can we ask the provincial government to give more funds to Humber to hire more staff to maintain the emergency department better? It's going downhill. It's a beautiful place, but some areas are not maintained. Too many patients. And you did talk a lot about the number of patients that are there.
There are a lot of patients. Our emergency department, which has only been open 10 years, was built for 300 visits a day. We see over 400 patients. We continually adjust and look at what are the construction work we can do to upgrade it. You have to imagine that that would mean closing rooms. And so we're balancing, do we really want to close rooms and increase wait time? So we have a lot of work to do on it. Healthcare asks for new money all the time. I think as maybe taxpayers and citizens of Ontario, we have to be sure that healthcare doesn't use every dollar in the province. So what we need to do as hospital staff, as physicians, and as hospital administrators on our board asks us to do is to look at ways to be more efficient as much as we can. That's why some of the technology we've put in place, but we do continue to look at not only how we can be more efficient, but if we can hire more staff. I should say for Humber River Health, we do not use agency nurses, and you've heard a lot of information in the press about agency nurses. Humber has not used agency nurses since 2023. So one of the things, and this is not to say that our staff and physicians are not busy, because they are busy every day, but one of the benefits at Humber River Health, and I think it also contributes to our safety record, is that all of the staff that work at Humber River Health are Humber River Health employees. And so that means that they are trained, the nursing staff are trained here at Humber. They know our policies and procedures, they know each other, they know our physicians. And that makes a smoother process for care when you're working with a team where each of you know each other and you know what the hospital practices and expectations are. So we're very proud of that. And I think that allows us to do better care, higher quality care, much easier.
Let's go to the voice questions, and I don't know if it's Miss or Mr. Lavecchia, but you have a question about why the emergency department assessments are not done by a physician. At least that's the contention. Can you just state that question, and then Barb will try to answer it?
Yes. Okay. So it's not just towards the physician. It's just that I happen to know for a fact that an initial assessment makes for a speedier diagnosis, and also it helps out to know what's going on with the individual that's showing up. So when you're doing the standard assessment, which is the heart rate, breathing, looking at the pupil, checking in the nose section, checking the throat, checking the ears, in the way the old-fashioned doctor used to do it, you're already removing, a good 60 to 70% of any diagnosis that can be done within within that assessment, which makes it a lot quicker to see who will need that help or not. There's been many instances when, as you know, somebody has shown up in the emergency department, and then within a short time they've been sent home, and then all of a sudden the person either dies or his situation gets aggravated. So I can't understand why the medical association would have removed that part of the old hip section, which would allow a doctor to have that 10 or 15-minute assessment whenever he's encountered with a doctor. I mean, that's me. We can talk about AI and then all kinds of other stuff, but a physical assessment, it has always been the most direct way to know whether a person has a condition or not, which a well-qualified
Thank
doctor.
you for that. Why don't we give Barbara a chance to respond, and then we'll move on to a couple of more questions and to our next segment.
And Dr. Ahmed may want to join me. So first of all, triage is exactly that. In hospitals, we work as teams. There are not enough doctors in the hospital to see every single patient for a complete history. But the nursing staff that are well trained for this, they do a full assessment. That is documented in the record. And when the physician comes into your room to see you as a patient, provided the patient stays to be seen, all of that is reviewed and looked at by the physician. So he has the history for the patient, knows what the heart rate is, has the blood work, if blood work's been ordered. And there are what we call standard protocols in an emergency department where the staff, the nursing staff, will begin some of the work and some of the diagnostic testing that needs to be done depending on what patient comes in. So it's actually a more efficient way. What you may not know is that the physician has access to that information in the record. Maybe it's something we could tell patients when the physicians come in the room, and I'll take that under advisement, and we can speak to the team about that.
Dr. Ahmed is coming up on the next segment in just 1 minute, but I thought we should take one more question on the emergency room, and it comes from Dr. Evelyn Adams, who has a question. Dr. Adams, welcome to the webinar, and you wanted to ask a question about older patients who present.
First, thank you very much for this webinar that you're having, and my question is about the education of emergency staff. Young physicians as well as registered nurses and other staff on the reception, assessment, and supervision of the population over 80. This has not happened at Humber, but it has happened elsewhere, and I'd like to see it prevented everywhere. Majority seem to be treated as if they have dementia. And of course, as you know, they might be dehydrated or have an active infection, in which anybody might seem a little bit demented. But the actual, reception and assessment and supervision, when we have reports of people waiting 8 to 10 hours in emergency, and in some hospitals, and to me, it has to be in that age group. It has to be because the staff's not aware of the type of attention they need.
So let me just quickly say a few things. Humber has a seniors care strategy. We have a fairly significant seniors care strategy throughout the hospital, given most of the people we care for are seniors. In terms of dementia, you're right. It's a very real thing. And you see that kind of behavior. And initially people will jump to dementia, but you're right. It might be their blood work that's out of whack. It might be the drugs they're taking. And we do have provincially, and Humber has implemented a dementia strategy where we look at what might be causing that dementia. And in fact, one of the tiles behind me, not so much in the emergency department, but on admission of a patient, tracks their dementia. Have they been up? Have they had the right food? What drugs are they on? What has changed in that person that might be causing dementia? So it is a very big focus for hospitals, and certainly happy to talk to you offline if you have a particular example of the problem, but dementia care is a significant aspect that we work on at Humber Health.
Okay, we mentioned in the introductory remarks that Humber has done a terrific job based on the numbers, based on actual measurement when it comes to safer care for patients. The numbers being 60% better than the average of all Ontario and Canadian hospitals, and that leadership position has been maintained for the past 6 years. And Dr. Zaki Ahmed, who's the chief of staff here, obviously a doctor, as I said, he is going to address that. The reason he's not sitting with us is he's at a conference representing Humber on the national stage. And he's going to talk about safety and how it is a top priority of the hospital and how those numbers have been achieved. Dr. Ahmed, over to you.
Thank you very much, Mr. Tory. So I'll answer some of the questions that have already come up about patient safety that some of the callers have called in for. So starting off with Dr. Adams' question about what do we do for people who are coming with delirium, I think we know as physicians that most of the people who come into the hospital with symptoms that look like dementia may actually be delirium. And delirium, as Ms. Collins just mentioned, there's a lot of reasons for delirium. Number one being the medications that people are on, some of the electrolyte imbalances, which includes dehydration, liver failure, infections. You've got retention issues, where people have urinary problems. There may be something intracranial, and then lastly, what we think about is someone who's had dementia that's gotten worse. So those are some of the things that we train our physicians with. Some of the other areas that we start off with are right from orientation, where staff is undergoing rigorous simulations. They prepare them for scenarios that respond to medical emergencies. They manage complex patients' interactions, like we just mentioned. These intensive training programs, they integrate all the patients on the hospital's core safety practices. They ensure that the staff that is going to be taking care of these patients are well prepared before they begin work. In addition to that, we have simulations. So simulations right from emergency room up to the operating room or to the delivery room, depending on what kind of simulations we're running. We also run areas where the staff is continuously getting best practices. What are the evolving needs of the patients? Where we talked about the equity lens in terms of what patients need from an equity lens. We learned a lot of that from the COVID era. The leadership plays a key role. It reinforces culture of accountability. We make sure that the staff is contributing to patient safety, is given awards and public acknowledgements. As previously mentioned, the command center that you're seeing behind Mr. Tory there, it works behind the scenes. It makes sure that every patient's experience is better, safer, and faster, as well as some of the AI tools that we have built in that tell us that the patient's going to get worse, looking at early warning systems. Looking at that, we've reduced the incidence of critical events. We've had safer outcomes for patients and the staff. We've had decreased wait times because of that, and we all know that the less people have to wait, the safer the care is. We do this by having greater one-to-one patient interactions. We have staff and physicians that feel empowered to talk about safety, that if there's any issues that they bring it up. We do have a lot of surgical innovation that we base it on. So things like the IntelliJoint, Rosa Knee, the Da Vinci Xi robot. These help make surgeries a lot less invasive to the patients. so they don't have to stay in the hospital as long. They have reduced complications. They're able to get back to their homes, their work, and have lesser impact on the quality of life that the people have. We also have been part of the National Safety Quality Improvement Program, which is run by the American College. We're one of the only hospitals in Ontario that has met those outcomes on all 5 of those metrics. They have better outcomes based on experience, better outcomes in terms of their surgical risks, things like that. That people really matters to how well they do. As Mr. Tory just mentioned, our medication safety is second to none, at being less than 0.01%, which is incredible in terms of when you look at it from a global scale. And the success that we have, it extends beyond what we have. So things like quality improvement initiatives, we have hospital policies that directly impact patient care. And we do this with conjunction with our patients and families. So we have families that look at our data. We have patient family advisory committees, which are looking at the policies that we're looking at. And as a high reliability hospital, we follow all the accreditation standards. We met our last accreditation by a score of 99.9% by the Accreditation Canada. So we're doing very, very well in terms of quality. But what really matters is how the patient does at the end of the care that they've just received.
Thank you, Dr. Ahmed. We are going to take another poll just because it's important for the hospital to know how you would prefer to have the hospital communicate with you. And this one has more options. So if you pay attention to the list that I'll read off, and again, it's very simple to vote for the one simply by picking the number that represents the way in which you best like to hear the hospital communicate with you. And after that, we'll take a few more questions on the phone and a couple from the written questions that have come in, and then move to the next segment. So here are the options for how you would like best for the hospital to communicate with you. Press 1 if you want to have communication take place mainly through the Humber River Health website. Press 2 if you would rather see it happen through flyers in ads or local newspapers. Press 3 if your preferred choice is the hospital's social media channels. Press 4 if you'd like direct mail to your home. Press 5 if you'd like an email newsletter from the hospital, which you can subscribe to. Press 6 if you'd like television or radio ads to be used. And press 7 if you'd like posters or electronic displays when visiting the hospital. I realize a number of you might say you'd like all of the above, but we're just having a look at which one you think would be best for you. And as soon as we give you a chance to vote, I'll do it one more time. We'll give you the results that you told us. And it doesn't mean that we wouldn't do all of these things. We probably do most of them already. 1, preferred communication channel is the Humber River Health website. Press 1. Press 2 for flyers and ads in local newspapers. Press 3 for the hospital's social media channels. Press 4 for direct mail to your home. Press 5 for an email newsletter from the hospital you could subscribe to. Press 6 for television or radio ads. And press 7 for posters or electronic displays that you see when you're visiting the hospital. Let me have a look here and see how people have voted. They're still coming in. But the highest, well, I'll just tell you what the results are. 27% picked the Humber River Hospital website. Only 6% picked flyers or ads in local newspapers. 3% picked the social media channels. 29% picked direct mail to your home. 32%, that's the highest number, picked an email newsletter. And 4% picked television or radio ads. So that's and then finally 2% picked posters or electronic displays. So you clearly want us to reach out to you in one way or another, and that's very helpful to the hospital's executives and communication staff. So let's take a couple of questions. There were a couple of Barb that came on the subject of homelessness. One that just says, how will Humber Hospital, this comes from Linda, how will Humber Hospital support the impending homeless shelter? And then another one is on a related, very closely related subject, which is, where is it here? May have gone away, but there was one that was just asking generally what the hospital is doing to improve services for the homeless as a hospital. It's here somewhere, but it's maybe gone off. Can you just maybe deal with that subject?
Okay. So a couple of ways. First of all, the hospital works on this, but we also work with our Northwest Toronto, Ontario health team partners. 38 community agencies that have come together to provide care. Let's talk about the homeless in general, because we have that issue, and then I'll speak about the shelter, what I know about it. On the homeless front, the problem has become a little bit better than we had seen about a year ago. But in all of the cases where we see the homeless, our agencies come together and look at what services can we provide. How can we find people permanent homes? That's an important and a key component. People should not be living in shelters if we can help that at all. So it's about, first of all, helping to find out why they are homeless. Is it about a job, or is it about immigration? Is it about status? What are the reasons for living there? If there are mental health issues, can we help treat that through the agencies? Can we work with our community agencies to find locations for people where they can live in a more comfortable shelter? That is the first piece of it. We do come together collectively to try to solve these problems. We recently opened a service at the Finch site with the Northwest Toronto OHT called the Hub at 2115. And one of the things the Hub does is they do help people get landed status. They help people get immigration work done. They help people find places to live and jobs. That's an important part for the team, because that helps to get people better and to get them into a better setting. We do lots of outreach around mental health. We have programs at the hospital, but our community partners have programs as well. And we work along with them to ensure that. And then we do vaccines, we do medical treatment. We bring people to the hospital to ensure that they get care, and they usually leave here with their prescriptions of drugs and that kind of thing so that they can maintain some level of health. So that is one of the things we do. On the shelter, I am fully aware that there is discussion about a homeless shelter being put in this area. Do not believe that final decision has been made at all. But in any conversations there have been with the City of Toronto, it's a City of Toronto initiative. Humber River Health team has said, and our Northwest Toronto team has said, let us work with you on it. So we're providing services for people in the shelter where they need it to try to keep them healthier and help them move to other services that we will continue to offer.
All right, let's just take a couple of calls. One is just someone that has a positive comment about their experience, and it's always nice to hear from them. And that's Dominico. Dominico, are you still there? You're very patient holding on. And do you want to just
Yeah, I'm
comment on
here.
your own
I'm here.
experience?
I'm here. Can you hear
Please
me?
go ahead.
Can you hear
Yeah.
me? Okay.
Yes, we can.
I really have to say that Humber River, they do a really good job. Like, you got to remember one thing. Like, there's so many nurses on the floor, okay? There's so many people on the floor, okay? These nurses, I got to say, I've been there through, like, when my mom was there, when my dad was there. Like, you've got between 8-10 patients to each nurse, okay? And it's really tiring. I could see those nurses that at the end of their shift, they can't even lift a needle. I've been there. I've seen it all with my own eyes. And I really feel sorry for them. The other thing is that we're on the right track. Like, we got to definitely work with what we have, okay? Humber River has been so good. Okay, we're rated most likely the number one hospital, probably, I would say, in the world. You know, like for Ontario, I mean, there's no better than that hospital. Another thing is that when it comes to shelter, okay, like I don't know what the conversation was too much, but the hospital shouldn't be responsible for that. Like they said, find them a place, let them go off with their meds, get a professional. This I agree, but we cannot house people that need a home in the hospital, because there's sick people that need beds every single day. And
Dominico, can we say thank you very much for that very positive review and for some of those comments that I'm sure Barb and the entire administration here will take to heart. I'll just remind you, we're going to move on to the next segment, and I should say, by the way, somebody, a Downsview resident, wrote in to say, how do we want to hear from you, have more of these town halls? And there are literally hundreds of people that are here with us tonight, and some of them posing questions and many just listening, which is fine. But my name is John Tory, and I'm just moderating. But I'm here more importantly with the CEO of the hospital, Barbara Collins, and with the chair of the board, Michael Iacovelli. And he's up next. And also, of course, the chief of staff of the hospital, Dr. Zaki, Ahmed, who's not here, but he's at a conference and has taken the time to make sure he can be part of this. And again, to remind you, if you have a question, please dial *3 and get into the lineup for questions. And if you're dropping your question in the chat, you can just type it as you would do. And we'll do our best to go through as many of those questions as we can. It is now the turn of our board chair, Michael Iacovelli, to answer this question, which is, can you please tell everyone watching and listening tonight how Humber River Health is focused on enriching the patient experience? If a patient walks through the door of Humber River Hospital, what can they expect? What is the board asking the hospital administration, the CEO, and everybody else, the whole team, to deliver in terms of that focus on patient care and enriching the patient experience?
Well, thank you, Mr. Tory. There's two things that I noticed when I joined the board at the hospital. One was the hospital is very focused on innovation and doing innovative things for its patient population. And the second thing is it's very focused on the community. The community is critically important to the hospital, and the patient experience that the community feels and the diversity of the community is critical to how we come up with the different innovative technologies that are used to enhance the patient experience. So I'll talk about a couple of the different types of technologies that are being used, and that everybody who comes to the hospital will feel and see. So one of those is, if you've ever gone for an MRI or a CAT scan and you want to get the results, you want to see what those results are, we have My Humber Health portal that you can sign up for. And I can tell you, in my own experience, I've received the results of my investigatory tests in advance of my doctor. So that's kind of the power of some of the things that we can do. One of the other very impressive technologies that we have that really helps family members who bring loved ones to the for a surgery is Steris Real View. So you can give them your telephone number and you can say, my loved one is having surgery today, and with the proper authority, you will get notifications on exactly what is happening with that patient through that patient's experience. So when they go in for surgery, you'll get a text. When they are finished surgery, you'll get a text. When they're in recovery, you will get a text telling you that everything has been done and they're moving into a different area. So one of the other things, sorry about that, that's our command center actually doing exactly what it's supposed to be doing, which is one of the other technological innovations that helps the hospital move forward and helps our patients get to beds faster and take care of quality issues and illnesses that come up. So some of the other things that happen, our nurses actually, and this is actually a good segue, our nurses have mobile devices, MASCOM devices that allow them to know exactly what's happening on an instant basis. So it's things like what you're hearing in the background in the command center. The command center can actually reach out to a nurse directly, identify that there's a problem with a specific patient in one of their rooms, and allow them to go and action that activity that needs to be done. One of the other things that's a little bit more personal is Pepper. So Pepper is a social robot. And I have to tell you, when Pepper arrived, I have to say, I thought, okay, this is a gimmick. This is a little branding exercise. It's cute. I don't see what the purpose is of this, but it's cute, and I don't see the harm in it either. But what it's become is a positive tool and a necessary tool for our pediatric patients. So the children come to the hospital and they have to go through a surgical procedure. They are nervous. They are not in a comfortable space. And Pepper, believe it or not, helps. Pepper reduces the anxiety, convinces the child that everything's going to be okay, and works with that child and the doctors and the staff to bring that patient forward. It's a fascinating technology and something that really does work. One of the other things you'll notice around the hospital, if you're walking around the hospital, that helps with patient flow, is our automatically guided vehicles. So there are these what look like carts just driving on their own around the hospital, and they're autonomous vehicles. They'll stop if you're going to run into their path, but they are delivering medications. They're delivering supplies. They're doing a number of different things like that autonomously without requiring any individuals, and doing it on a timely basis. So these are kind of some of the innovative technologies that help with the patient experience. But there are some bigger picture items that we're also engaged in, and kind of new and expanded services that that Humber is providing and working on that, like I said, goes to exactly what our community needs. So we're always looking at what our community wants and what our community needs from a healthcare perspective. One of those things is we have one of the busiest cardiac departments in the province, and yet you can't get catheterization at Humber. So we have patients that are in our catchment area that are frontline workers that are working during the day constantly, hardworking people that don't have the ability to come to a local facility to get that service. They have to go downtown, they have to go to another hospital to get that service. And we're focusing in on those things that are important to our community, that are needed in our community. So one of the things we're doing is we're building a catheterization lab, cath lab, right now, and moving that forward in order to provide that service locally at Humber, rather than forcing people to go an hour away to places that they don't really have the time to go to, and that in areas that are not familiar. And one of the other things that's a particular problem in our catchment area is primary care. We don't have enough primary care physicians. You've heard that on the news. There's not enough primary care around the province, let alone in our catchment area. But the Northwest Toronto catchment area has a particular problem with a lack of physicians, primary care physicians, to support the population. We in the Humber family here have 22,000 patients that are unattached. They don't have a family doctor. And we looked at it and thought, what is it that we can do to try and make that situation better? And so we partnered with the University of Toronto and their teaching unit associated with family medicine, and opened up the Schulich Family Medicine Teaching Unit with the hope and intention twofold. Threefold, I guess. One is to take some of the pressure off the emergency department, because as some of the callers have said, there are a lot of people at our emergency department, and some of those people don't really need to be there. They should be with a primary care physician, but they use the emergency department as their primary care. And so one of the purposes of the family medicine teaching unit is to support the emergency department, to provide that kind of service directly without people having to use the emergency department. The other reason is to try and develop doctors, teach doctors, and provide doctors that end up in the community supporting our community. So we're hoping that the doctors that are coming through and learning through the process are going to remain in the community, are going to be able to support our community and the patients that live here. And the ultimate intention is to try and get 10,000 of those 22,000 unattached patients attached to a family doctor that they can go and see on a regular basis.
I think that was a very complete answer, and I will tell you that it answered two of the questions from Laura and Asherina, who've been waiting for written questions about what we're doing to help people have contact with a family physician, with a primary care provider. Just a couple other questions before we move on, because it's time to do that, because we have some people that have been waiting very patiently. One, for example, I don't know who might answer this. We want to bring Dr. Ahmed into this too. Are there any plans to have PSWs in the hospital to provide patient care that nurses are unable to do? Maybe you're doing some of that already, or maybe you don't have plans, but that was a question that came from Cheryl.
Okay. Cheryl, so we tend to look at this and the skill of which staff member we need the most. At this point, Humber has no nursing vacancies in our full-time staff. So often hospitals will move to PSWs if they cannot recruit nurses or if they have a vacancy. At this point, our nurses on the surgical and medical floors have about 5 patients each. At night, it might be 6, often it's 5, and we are fully staffed. So we have not needed to move to the PSW role. Not to say that some of our staff don't ask, could we have one? But at this point, because we are able to recruit enough nurses, we really feel an RPN or an RN who can do a much larger scope is an effective way to deliver care. So that's where we are with that.
Maybe I'll refer this question to the doctor, Dr. Ahmed. Rita tells us that her mother, unfortunately, has been in and out of the hospital since early February with the same chronic issues. How does a patient's family have confidence that Humber River staff is doing the right tests to help a patient and to identify the root causes of the illness? And that's it's a lot of it's about trust. I know, Dr. Ahmed, but maybe you could just deal with that, because Rita's asked a question a lot of people think about from time to time.
Yeah, absolutely. Thank you very much for that question, Rita. So you're absolutely right. There's a lot of our population, especially the elderly, who don't necessarily have the continuity of care, especially as they don't have family physicians, to have that ongoing care once they leave the hospital. As a result, a lot of them end up coming back to the hospital. So, as Mr. Iacovelli just talked about, one of the ways to do it is that you do have access to the records that your parents or your loved ones are going through in terms of care. So they have that access that you can take a look at. You can interpret the test results, the lab results, the physician notes in terms of consultation. To know which are the right ones that are being done and what they're thinking about.
We're going to leave you on the hot seat in just a moment here, Dr. Ahmed, but before that, we're going to take one more poll, and it's one that just tries to get a feeling for how you feel about what you've heard tonight. And the question is, based on what you know about Humber River Health and what you've heard tonight, do you think that the hospital is focused on the right thing? This is a fairly straightforward one. If you say yes to that, press 1. If you say no to that, you should feel free, if that's how you feel, to press 2. And if you're not sure, you should press 3. So again, how do you feel based on what you know about Humber River and what you've heard tonight as to whether the hospital is focused on the right things? So 1, if you want to say yes, we're focused on the right things. 2, if you want to say no. And 3, you're not sure. Have a look at those results and report those to you momentarily. And just to remind you again, we're into our last segment, but we're here. It's John Tory here as the moderator, and Michael Iacovelli, the chair of the board of the hospital, Barb Collins, the president and CEO, and the chief of staff of the hospital, Dr. Zaki Ahmed. We'll deal with our last topic, which is about specialist availability. And to give you those results, it's not a bad report card. 58% say yes, we're on the right track. 8% only say no, and 34% aren't sure, which is understandable because it's a very complex topic and a lot of very deep questions that have been asked here tonight. Dr. Ahmed, one of the things we wanted to cover tonight is that there are lots of people, of the hundreds that are watching and listening, who are interested to learn more about the physicians and the specialists in the areas of healthcare that Humber River provides. Can you tell us more about the sort of very wide variety of things that are done here and the wide variety of talented professionals that you have serving the public?
Yes, absolutely. Thank you. I think before I get into the specialists, I'll talk about the family medicine. So, as I said, a lot of our population, I think it's over 20,000 people who don't have access to family docs. So, our Schulich Family Medicine Teaching Unit is one where we can start providing that primary care to people. In addition to that, we have specialties like bariatrics clinic, fracture clinics, healthy living clinics, endocrinology, neurology, urology. We have cancer care. We have mental health services, which provides inpatient services, outpatient services, adult services, youth services. Our orthopedics program has the lowest wait time. So if you need a hip or a knee done, this is the place to do it. Our pediatrics clinic is very well subscribed. So a lot of our kids in our population, in our community need help. And that can be provided at the hospital. For women's health, conditions like menorrhagia, endometriosis, miscarriages, and of course, delivering babies. In addition to nephrology, which is a huge program, our kidney patients are 62,000 hemodialysis treatments every year. So we have a lot of clinics that can be provided that you can get access through either through your family physician or through the emergency room and be able to get seen by the specialist in a very, very timely manner.
Could I just ask you a question? We've got some questions. We want to cover those off before we move to the last couple of topics. One is, it's kind of an interesting question given everything that's in the news. If you have a choice between using AI or hiring a human, how and in what situations would you consider using one over the other? And that's a question, I guess, best asked of a doctor. But do you have any comments on that, given the AI nowadays?
Yeah, that's a great question. I would say both, because you cannot do with one versus the other. It's one in conjunction with the other. So physician decision making is very well supported through AI. So it's things that we can't necessarily see with our eye. AI picks up on. So they see patterns very well. They're able to see the changes that are happening over time, whereas we can see one time versus the other. So it's always in conjunction where we need a physician, we have a physician, and which is supported through AI, whether that brings patient voice into the medical record by listening to what you're saying and being able to convert that into notes so that that's sent to all the providers that we have.
I had on the radio this morning an AI executive who said that the AI was going to replace teachers. And I said, well, what about emotional support? And what about, there's a lot of things that doctors and nurses are going to be able to do no matter how good AI gets, but we'll see how that all unfolds. I was going to ask you a question, Barb. Judy here asks us that she has 4 kids with 1 more coming on. That's a big family. We want that to keep growing the population of the country. She'd like to know what we're doing for children. She says some other organizations have walk-in kids clinics.
Yes. So we did have a children's clinic at one point. It's something that is being looked at. We do have a lot of pediatric clinics in the hospital, though. Again, through family doctors and other resources, you would be able to be seen by a pediatrician for sure. And a lot of work with Hospital for Sick Children. We have a partnership with the Hospital for Sick Children. We worked with them to try to deliver surgical care and medical care, surgical care more than anything, to patients in our own community. Again, that idea of people don't have to travel downtown, and the surgeons from Hospital for Sick Children and their anesthetists come here, and we do about 600, just over 600 procedures a year for local children to have care here. So we have clinics, and we do also have the surgical program. And the children's clinic is something we are looking at right now. Our children are very well looked after through outpatient appointments in different clinics.
Barb, this is one more question I think is very relevant these days in the news. Noah says measles have been all over the news. What's the hospital doing to keep people safe if they come down to work?
Thank you very much for that question. And you're right, it has been a problem. First of all, working with public health to ensure that children and other people that are not vaccinated are vaccinated and up to date. And that has been an important activity that we've been involved in. But it's really about training our staff and training everybody to observe for the signs and symptoms and to very quickly get that person into isolation. We've had a couple of cases that could potentially have been contacts or potentially been measles, and I'm happy to say the staff worked very quickly and identified it. We also have many signs and posters up around the hospital reminding people, and please everybody just remember this, if you're unwell, don't come to a hospital. The unwell people in the hospital don't need additional germs. But aside from that, we do post at all of our entrances the signs and symptoms of measles, and we ask you to stop, make a telephone call, and we'll help you through the process. And again, if you think you've been a contact, don't come to the hospital without calling us. We'll meet you, we'll do the protection work and keep other people safe.
We'll keep you working because you're going to do the next segment on community involvement too. But one more that came from a phone call. We'll let him ask the question himself. Paul Archibald, you've been very patient. You wanted to ask a question about prostate cancer.
Yes.
You there, Paul?
I wondered why I used the prostate center that was up around Bathurst and Finch, opposite the school there. And I was just wondering, is there any plan to have a prostate cancer center at the Humber River, or what was the reason for closing that center?
Thank you, Paul.
Thank you, Paul. I'm certainly happy to have Zaki join me on this, but we have a very large urology program right here at the hospital on the 2nd floor. We do many prostate cancer cases. That's the diagnosis and the surgery that's required. And in fact, Humber is one of the few hospitals in Ontario that actually does this robotically, which is faster, safer, and healthier for the patient. So we have a very comprehensive diagnosis program, very comprehensive surgical program, and then a very comprehensive treatment in the cancer center. So we do that work within the hospital. It would depend on where you were referred, but when we moved to this site, we opened that program.
All right, so the last topic of the evening, and we've got a bit of time left. I don't know if they're going to let us go a few minutes over 8 o'clock, or whether a hand will come down and reach down and grab me and bring it to an end. But this is for you, Barb. The next topic involves Humber River Health's mission, working together with the community to provide safe and equitable and innovative healthcare. Can you tell us how you work together with the community? Many of whom, 500, are on the line listening to us tonight.
So I'm happy to answer that question. And a couple of things I wanted to talk about as I get to that question. It's Northwest Toronto is a very diverse community, and it has equity challenges in many parts of our community. And that means it's harder for people to seek healthcare. They may not even know where to go. It may be difficult to take time off work. So one of the things that we have done is come together as a community, Northwest Toronto, Ontario Health Team, and we want to look at how we can provide services in other areas of the community, not just coming to this emergency department, and how we can work with those 38 partners to bring care to people where they reside, in their condos, in their apartment, in their long-term care home. And so Humber works together with the Northwest Toronto OHT team to look at what the needs are and how to work on them. The other piece that we've been doing, both as a hospital, and it's been great work with the Northwest Toronto Health Team, is looking at how to really provide care that is respectful of a person's culture and respectful of their diversity. And I think that's a very important piece for all hospitals to be part of. Humber and our Northwest Toronto Ontario Health Team have actually been out asking the community and people in the community, what does culturally sensitive care look like to you? So the Northwest Toronto OHT was actually one of the first teams to be approved by the government to expand their services and to develop services. We work with a number of committees, a number of groups. We look at patient and family-centered care. We look at how we transition patients from hospital to community. And then we look at how we assess and manage patients so that they don't have to come back and forth between both. Or if they do have to, because in some chronic conditions, you come to the hospital an awful lot, are we handing off care between the two partner organizations? I spoke briefly, and I'll say it again, we recognize that at the Jane and Finch community, as we move the hospital to Wilson, a bit of a gap in care there. And with our Northwest Toronto OHT partners, we opened what's called the Hub at 2115. The hospital provided the space, provided the renovations to create office space and meeting space where people who want to access care, want to access other services, are able to do that, and we bring them together there through that group as well. We are creating and have created that space to be a one-stop shop for mental health support, for diabetes education, employment services, and it's really designed to meet the needs of the population in Northwest Toronto. So these are the kinds of things we're doing to really work with our partners to deliver care. The hospital cannot deliver all of the care in the community, nor should it. It's bringing these partner groups together, sharing our resources and planning for the care.
So just a couple of questions that do relate to the relationship with the community, probably for you, Barb. Esther Simon asks, says the hospital provides services to people with no immigration status.
We do. We do provide services to people with no immigration status. Now, that means that they don't have OHIP coverage in most cases, and so we will work with those patients. There are also community health centers that are actually funded. Black Creek Community Health Center is one of those, and Cheryl will not mind me mentioning it at all. It's a great organization that has some funding for recent immigrants and people that don't have healthcare coverage. We work through it with the province of Ontario, trying to ensure that there is some level of care available to patients.
All right, and William asks, is Humber River Health partnered with a home care agency?
We have not partnered specifically with a home care agency. We are partnered with Ontario Health, who provide home care services. And you may know that recently Ontario Health established the Home First program, and we work very closely with them. We have a large team of staff that go out to the home that also help patients get placement. And we do that also with our long-term care homes. We've maintained a relationship with 9 of the long-term care homes in our community, 10 of them actually now, where we go out and help with processes and care in those homes as well, trying to keep people where they live as opposed to having them come to the hospital.
We have Mary for one last on the line call. Mary, you had a question about radiation at Humber River Health. You there, Mary?
Yes, hello.
Hi, what's your question? Go ahead.
Yes, hello. Hello.
Okay. Oh, hey there, Mary. You're on the webinar now. Everybody's listening to you, so please ask your question.
I'm wondering if Humber River Hospital is going to be having a radiation therapy for cancer patients, or do we still have to go to Brook Health Center?
So, that is a very interesting question and one that we ask about a lot. There's an approval process for radiation services. We have spoke with the government about it. There is capacity right now for radiation. One of the things we have recently done is we are partnering with Princess Margaret Hospital, and they are going to make their physicians available to our staff, our patients here, to at least start the discussion around radiation. At this point, you still need to travel to another hospital for the services, but it is something we are looking to for our community. As our board chair said, we're trying to find all those kinds of services that we can deliver in Northwest Toronto so people do not have to transfer downtown. Does require Ministry of Health and government approval to go there.
All right, just one more here before we sign off and say goodbye. Susie has written here and said that her particular ER concern has not been addressed or acknowledged. Her mother was still an inpatient and so on. And she wanted to know if someone could contact her family. I just want, how should she do that if she's here now?
So if your mother is here now, I would like you to speak to the resource nurse or the manager of that unit, and they will set you up with whatever help you need for answers. We also have a patient ombudsman, but offline the team will give you my phone number as well, and you can call me anytime and I'll work through it with you as well, or get you in contact with the right people. But always remember, when a patient and family member is in the hospital, first of all, you can always speak to the manager on that floor or the resource person on that floor who will help get you in touch. And where there are really, really complex cases, our physicians hold family conferences where they bring the team together and we talk about what care is required for the patient, and the families can be invited to that.
So Susie's somebody who gave a written question, so we may not have a phone number because we have them for people who call. But Susie, if you wanted to call in at this point in time, pressing *3 before we sign off in the next minute or so, they can pick up your particulars and make sure somebody can get back to you. But as Barb says, probably the best thing to do is speak to someone on the floor where your mother's a patient, the resource manager, I think you called it, and that somebody who I'm sure can help, and that's what they're there to do, is to help you. So, but do call *3 and talk to the people that are taking those calls in the next minute or two before that's shut down, and I'm sure they can take your information as well. So that's the end of the time that's allocated for the town hall. And we literally have had 2,000 people that had some interaction with the whole process. Maybe they didn't watch for the whole time. That would be a lot to ask because it's a very complex series of subjects. But 2,000 people did. Hundreds stayed on for the whole time. And dozens of you asked questions. I'm sorry I didn't get to them all, but I got to as many as I could and as many of the phone calls that people made. Any closing comments that any of you would like to make? I'll start, Dr. Ahmed, with you. You're out of town at a conference, but gave your time to be here. And on the medical side, do you have any comments to just close with tonight?
Yeah, I think just to reiterate what Barb was saying, that if there are any questions, physicians who are taking care of the patients, whether that be in the emergency room, outpatient area, or inpatient area, just feel free to ask that question because medical care is very complex. And it's just reasonable to have people explain what we're doing, why we're doing it, what are some of the things that are urgent, some of the things that can be put off and are not advisable at this time. So please feel free to ask questions. That's the best way to do it.
Michael, from your standpoint as the chair of the board, any comments you want to have on this process or anything else that we've talked about tonight?
No, just a note that thank you very much to everybody for participating today. It was great to have as many people as there were watching and trying to find out more about the hospital. Hopefully, we as a board, we thank you for your trust in us to help do the things that we do and help the hospital do the things that it does. And as everybody has said, if you ever have any questions or concerns, like to reach out, please feel free to do so.
All right, and last but not least, the woman where the buck stops. There's no seat hotter than the hot seat occupied by the CEO of any hospital, and that's true of Barb. She does a great job. Any comments you want to address to the people watching?
I do want to say thank you very much for being here. We've said reach out, and please, reach out to our staff, our physicians, any staff member at all. Most of the positive comments I get is that our staff are always willing to talk to people. And I just want to say about our staff and our physicians and staff and all of our departments, a really big thank you. The work they do makes a difference, and it does help the community be healthier. We always know we've got more to do, but I do want to acknowledge the work they've done, and we will take your comments back to them. So thank you very much.
And I want to acknowledge your leadership. I'm able to do this as the moderator, but Barb and her whole team. And I'm proud to say my daughter is a doctor here, Dr. Susan Tory, and that whole team, I've met many of them over time. They do a great job, and they did an outstanding job where I saw it right up close to the pandemic. I'm sure that goes on every day. And if we've left something out, we didn't get to your question, you have one that you didn't have a chance to put to us, there is the opportunity to email a question to communications@hrh.ca, or if you want to take a note of this number, you can call to the Patient Relations Department. That may be what Susie wants to do. We talked to earlier. That number is 416-242-1000, extension 82256. So that's area code 416-242-1000, extension 82256. That's the Patient Relations Department. So I'll thank all of our participants tonight, the panelists, and all the participants out there watching. And I hope this is something the hospital will do again. And we'll talk to you soon.